we're covering two systems. We're covering the integumentary system and then the skull. And so next week when we come back, I'll have the skin model out. The skin model's on Blackboard for you already. I have the skin model out. We'll have the two pelvises, the male and female pelvis. And we'll have the slides. There's a skin slide and a fingernail slide that we'll do next week. And then we'll have the test after that. So, okay? So today basically just working on the skull. You can work on it as long as you want, and you can go whenever you want. So at this point in the semester, it's basically up to you. Stay if you want, you don't want to. You don't want to stay, you don't have to stay. Okay? So, in an infant, the skull bones have not formed completely because you have an infant, its skull is small. You look at your skull is big. So you know that there's going to be some growth that's going to take place between the time the baby's born and the time that you become an adult. And so it doesn't make sense for the bones to be fused when the baby is born. So therefore, there's going to be areas that are not ossified in the baby's skull, and those are called fontanelles. Fontanelles right here. The common name are soft spots, but they're fontanelles is the correct name. And there's two functions for that. One is to allow for the brain growth, and then two is to allow in the ease in birth. And so when the baby's coming out of the vagina, then sometimes some of those bones will actually overlap one another, as from the pressure of the vagina, the baby is being squeezed out. And so sometimes babies are born with little pointed heads because of that. Okay, so the fontanelles are named according to the bones, and that's how I learned them. You can also learn them by direction too. Okay, so here's your frontal fontanelle, sphenoidal, mastoidal, occipital, one in the back. So frontal, sphenoidal, mastoidal, occipital. Or you can have anterior, posterior, anterior lateral, posterior lateral. So you can do that by direction too. Okay, any questions on the fontanelles? Make sure you're able to know them on this fetal skull here. You're able to label them, and make sure you know the functions of the fontanelles.
What were the functions again?
They're for the ease in birth and for brain growth. They're listed on your yellow sheet. If you look under fontanelles on page, which I assume that all of you read this during your leisure, of course, on page 5, it tells you about fontanelles. And it tells you, and it gives you the two functions in bold. So if you read on page 5, you'll see them. Okay, see them, everybody?
Yes.
Do not neglect to read this yellow pages. Thank you. You might miss something. Okay. All right. Sheena, when I finish here, your Scantron is due. Okay, we're going to go to a regular skull. So at the top here, we see the bones, the frontal, parietal, occipital bones. And now you are actually going to have the sutures which have formed. So the bones have ossified by the time you reach, actually, even before you reach adulthood, the bones have ossified. But not all the suture will ossify. Some of these sutures will not ossify completely until in your mid-30s. And so that was one of the hints on your Scantron sheet. Okay, so here's your coronal suture, sagittal suture, lambdoidal suture, because this one looks like the Greek symbol lambda. And sometimes you might actually have a suture right here that runs down here, and that's called a metopic suture. Metopic suture. But most people don't have a metopic suture, but there might be one that runs down the middle here. But the ones that everyone has is a coronal suture, sagittal suture, lambdoidal suture. That's right. Okay, and so here, whoops. So here you see your lambdoidal suture here with your occipital bone, your parietal bones. External, and here's the back here. External occipital protuberance was one that you need to know. In the male, this is very prominent. In the female, it's much less prominent, and that's one of the things they use to sex a skull. There are a number of other things that they use, but the external occipital protuberance is one of them. Another thing that they use to sex a skull, usually the superciliary ridges that hold the eyebrows right here are fairly heavy, and in terms in the male versus the female, and that's something else that they also use.
What do you mean by heavy? Like?
Heavy, they actually are heavy. They hang over a little bit more. Yeah, the bones actually protrude out more. Okay, and okay, so here you have your frontal bone, your two nasals, your zygomatic, which is your cheekbones, upper jaw, maxilla, lower jaw, mandible. And in the frontal bone, you have your frontal squama, glabella, which is in between your eyes. Where the eyebrows sit is called the superciliary ridges. You have a supraorbital foramen above the eye orbit, infraorbital foramen below the eye orbit. In the eye orbit itself, you have a number of bones. You have a lacrimal bone right here, where the tear duct is sitting. Then you have three openings in the eye orbit. You have an optic foramen, superior orbital fissure, and an inferior orbital fissure. In the nasal cavity here, you have your nasoseptum. The one above, the higher one, is called the perpendicular plate of the ethmoid, and the bottom is called the vomer. Then you see two of the nasoconchi out of the three. You know the three, they're superior, middle, and inferior nasoconchi. You can only see the two because the superior is way up here, and you can't see it on your skull. So you only see the inferior nasoconchi and the middle nasoconchi. Okay, and then in your zygomatic bone, you have a zygomatical facial foramen. In your maxilla, you've got your infraorbital foramen that I mentioned earlier. Intermaxillary suture, you have a hair lip if that doesn't close. Alveolar margin or process that holds the teeth on both the maxilla and the mandible.
On the foramen, up here on your maxilla, what are those? What's going through there?
It tells you on your yellow sheet.
Oh, I thought you was telling us. Teach us something.
Oops, wrong one. One of the branches of the cranial nerve, trigeminal. So, a repeat of some of these. Okay, then when we turn on the lateral side of the skull, you're going to have your squamosus suture right here, your temporal squama, mastoid process, externoacusic meatus, styloid process, your zygomatic arch. Here is the suture between the zygomatic bone and the temporal bone. This is your temporal process of the zygomatic bone, the zygomatic process of the temporal bone. Together they make up the zygomatic arch. On your mandible, you have your mental foramen, mandibular angle, mandibular notch, coronoid process, condyloid process forming the temporal mandibular joint. Then you also have lines up here, temporal lines that are there.